Hi, this is Dr. David Tenner, and we're here at the Goldberg Clinic for Chronic Disease Reversal. And today we're here with Miss Trina McIntosh. And Trina came to see us back in, I believe it was May of 2012. And we're very excited to have Trina here with us because she will be sharing her story with us. So Trina, tell our audience a bit about what brought you in to see us originally, what you were diagnosed with medically, and what kind of treatments you were under prior to coming to see us.
Okay. I came into the clinic being diagnosed with subclinical hypothyroidism, meaning essentially my thyroid levels weren't bad enough to be diagnosed with hypothyroidism, but were bad enough to be treated for such. And I also had 8 food allergies. I was 8 borderline food allergies, Epstein-Barr, and Hashimoto's hypothyroiditis as well.
What kind of treatments were you under?
Yeah, I have been seeing a naturopath for several years, and I've been taking a progesterone supplement as well as some thyroid thyroid helping supplements as well, some multivitamins, couple other immune supplements that are supposed to help the immune system. And after several years of that, my naturopath referred me to her MD because she said, you know, the alternative methods weren't working anymore. And the MD then put me on Synthroid, which I was on for about 50 days, realized it wasn't working, and then I came to the Goldberg Clinic.
Okay, so Trina came to see us at that point, and her story is really an all too common scenario for many of the young women that are in our population and now that come to see us here at the clinic, where their bodies are essentially out of tune, they're not functioning well, they're exhibiting many of the symptoms of a hypothyroid, weight gain, fatigue, which are some of the things that you were experiencing originally. And rather than address the causes of the problem, most of these patients end up in a vicious cycle of treatments, alternative treatments like you were taking with the naturopath, and are then eventually placed on thyroid replacement hormone, replacement therapy such as Synthroid, which is what you were taking, or Armour Thyroid, or Nature Thyroid. And most of these patients, when they start on these kinds of treatment therapies, are unaware of the fact that when they take hormone replacement, thyroid hormone replacement, that their own thyroid gland begins to degenerate out or essentially atrophy and will no longer function appropriately. So what kind of issues did you have while you were on Synthroid, and what was your outlook at that point?
I was a lot more emotional when I was on Synthroid. I noticed things that normally wouldn't upset me were upsetting me. I also had some severe pains in my low back and pains in my knees. It was almost hard to walk, just as a result. It was, I think, week 2 of being on Synthroid.
Right, so you're having not only the original issues still, you weren't really improving in that regard, but you're also having new problems as a result of taking the hormone. And again, this is because the original causes of the problems were never really addressed. And so we had Trina in, we did a proper new patient workup, case history, physical exam, ordered some lab work, and then really started her on a program not to treat her symptoms, but to rebuild her health, rebuild her vitality, and get her on a path in which we were now creating the proper conditions under which normal function could be restored, not just in the thyroid gland, but in all the glands of the body, all the organ systems of the body, which essentially work together to produce good health. And so it's been about 8 months now, 8, 9 months with Trina. And Trina, tell our audience what has changed for you. You're no longer taking Synthroid, is that correct? You're no longer on Synthroid. And what kind of improvements have you experienced over the last 9 months?
No longer taking Synthroid. I've lost about 10 pounds. I don't struggle to get out of bed as much in the morning. I have a lot more energy and not drained by the end of the day while I'm sitting at a desk doing, you know, using my brain. It doesn't drain me now. I'm able to just enjoy life and do more things.
Okay, so over the last 9 months, we've really seen some really great improvements with Trina's case. Her symptoms have resolved. Her overall health is much better. She's off the medications, the thyroid replacement hormone that she was taking. And in the process of getting her well, we've also taught Trina the proper behaviors in order to maintain the good health that she now has. And so, as Dr. Goldberg says, we've successfully started the process of turning healthcare now into self-care. So now Trina can go move forward, take care of herself, keep herself healthy, no longer need to be dependent on doctors of all kinds, including us. And so Trina, we thank you very much for joining us today, and thank you for sharing your story with our audience.
Thanks.